Welcome back to Community Matters. I'm Bill LeMay. We're talking about your health this winter with Dr. Nicole Swiner. Now, what do we need to know about Zika? That's a virus that's getting a lot of news, Doctor.
It is. So I guess the biggest thing is that, in the news we've heard about it's moving into the United States, in parts of Florida, and there have even been some reports of folks coming back from travel in North Carolina, kind of coming back with it. We haven't had any actual reports of people getting sick from it in North Carolina, but then coming back from travel. So it's become a huge deal, and we need to know a lot more about it.
And maybe we should start with, just the basics for folks. I know it comes from a mosquito, and it's just recently. I mean, it's been around for quite some time, but now all of a sudden it has some really severe implications for kids and mothers. What is it that we should be worried about?
So, particularly if you're going to travel to South American parts of the world, African parts of the world, there are reports there that the Aedes is called Aedes mosquito is the one that is transmitting the virus. And the difference about these mosquitoes versus the usual mosquito is that these mosquitoes usually bite in both day and nighttime. So usually, especially here in the South, it's when it gets more moist around, or it gets closer to the dark hours of the day is when the mosquitoes can come out. But this particular type of mosquito, which has not been identified in the U.S. as of yet, is the type to bite both during the day and night. So if you're going to travel, you're going to make sure that you're covered. Make sure you have long sleeves, long pants on. Make sure that you're covering yourself with the mosquito repellent DEET if you're going to be outside a lot. Making sure that you're, particularly if you're around areas where there is a lot of water, making sure that you're being as protective as possible.
Now, the virus has caused some birth defects, and at the same time, a lot of people who get the virus really almost no symptoms, correct?
Correct.
So what can a person expect?
So, not only is it being transmitted through actually getting bitten by a mosquito, but it's being transmitted sexually. So you want to make sure that, and we should, all be, protecting ourselves and practicing safe sex. But definitely, if you're exposed to folks who have traveled to particular areas, and if you're going to be in that area, you want to make sure that you're protecting yourself. The most devastating effect that it's had, that we've been talking about a lot, is birth defects called microcephaly, meaning a woman of fertile age or a pregnant woman of having it transmitted to the baby, and that causing some brain defects and some growth restriction of the head and the brain, and that potentially causing developmental delay or later on in life. So you want to make sure that if you are of fertile status or you are pregnant, you want to make sure that you are either avoiding traveling to those areas at all costs, or you're taking the precautions.
The person who is traveling, is there a time where they can go, phew, I didn't get it? Is there an expiration date, shall we say, on that travel versus when you might get it or not, or is it something you're going to have?
It's hard to say. I know the CDC, the Center for Disease Control, is still doing, and a lot of the different infectious disease organizations are doing a lot of studies on it. It's not clear as of yet. So I think you have to always be on your toes and always be ready to take those precautions. And so I've had a couple of travelers come back to the office and ask to be tested, because you're right, a lot of the symptoms you don't have. If you are going to have symptoms, they will be very flu-ish, very flu-like, but a lot of us will never know that you've had it and be at risk for transmitting it. So I've had a lot of people come to the office and just want confirmatory testing just to make sure they hadn't been exposed.
Well, that's good. So there is a test.
There is.
The virus itself, I don't know if you know this or not, but here's my silly question: is what changed? Is that something that just kind of happens? Because it has been around since the 40s. This is my understanding.
Even longer.
I mean, are we just now realizing it's had this kind of an impact, or is something changed with the virus and we should, I don't know?
That's a good question. I think there's probably been just a lot more research done, and they just happened to see a trend, particularly in some of the South American countries, for the birth defects that we've been noting, and then going back in time and kind of tracing it and realizing that these women have been exposed to the mosquito. So I'm not sure why all of a sudden it's making such a resurgence.
But it is, and people need to be concerned. And I know the holidays a lot of people go to warmer climates, and that's where the mosquitoes are most prevalent. But it's interesting that it's also now transmitted again via fluid, and that's an issue as well. So for our viewers this morning who might be planning a holiday trip, tips?
So make sure you're taking long clothing if you're going to be spending a lot of time outside. So long sleeves, long pants. If you're going to be sleeping outside, there are mosquito nets that you can get. Make sure you have a lot of spray with DEET. They are working on a vaccine. I'm not sure when it's happening, but they are doing studies. There are actually a lot of other viruses that they are testing to see if it also can prevent Zika virus, so that's hopefully coming very soon. But until then, washing your hands, using condoms if you're sexually active, if you are fertile or thinking of becoming pregnant or are pregnant, you might avoid traveling to particular areas. You can always check the CDC website, cdc.gov, to see what areas have been identified as danger zones, and you might just avoid those areas altogether until we know more.
And the other question I guess I haven't asked is, what if you have it? What's the treatment?
Supportive treatment. So just like the flu, there's no cure per se, but if you have the red eye, the conjunctivitis, the muscle aches, the fever, etc., go see your doctor, and then if you need, supportive care like fluids, Tylenol, other types of pain relievers, that's really the mainstay. There's no cure. Now, the good news is that most of us do fine, without any major treatment. And there have been rarely reported any major complications or deaths outside of the birth defects. So most of us, otherwise healthy adults, we do fine, but we treat it essentially like the flu.
All right, doctor. Well, don't go away. When we come back, we've got some tips for managing holiday stress. What? Stress during the holidays? Stick around.